Welcome back to The Explainer. Today we're tackling a massive milestone that affects hundreds of thousands of people every single year. Total hip replacement surgery. If you or a loved one are stepping into this journey, you already know it's a major life event. But the surgery itself? That's literally just the starting line. Today we're going to navigate your post-surgery recovery using the absolute gold standard official medical guidance from Medline Plus and the American Academy of Orthopedic Surgeons. We've distilled their clinical instructions to give you the ultimate guide to reclaiming your mobility. Let's get started.
So, what comes immediately after surgery? It's probably the very first thought that hits you when you wake up in the recovery room. The anesthesia is wearing off, you suddenly realize you have a brand new piece of medical-grade hardware inside your body, and honestly, the anxiety can be incredibly real. Caretakers feel it too. You might be wondering, am I going to break it? Or how do I even get out of bed? That anxiety is entirely valid. But here's the good news. Knowing the precise, medically approved steps for what to do next strips away that fear. When you know exactly how to move, how to rest, and what to watch out for, you aren't just recovering, you are taking active control of your own healing process.
To make this super digestible, we've structured this recovery explainer into 3 critical phases. 1. Caring for your hip. 2. Safely resuming daily activities. And 3. Preventing hip dislocation.
Ultimately, our goal today is simple. We want to provide you with a reassuring, empowering, and easy-to-understand roadmap for your post-surgery recovery. Medical jargon can be super overwhelming, especially when you're tired and trying to heal. So we're taking those dense clinical guidelines and translating them into a personal, actionable journey. By the end of this explainer, you're going to have a crystal clear vision for a successful, pain-free return to your normal life.
Okay, let's dive right into this with Phase 1. Caring for your hip, the foundation.
Before you can run, walk, or even comfortably sit at a dinner table, you have to make sure the surgical site and the surrounding tissues are properly cared for. For this foundational care, we're leaning directly on official patient instructions from Medline Plus. If you aren't familiar with them, Medline Plus is an incredible resource produced by the National Library of Medicine, and it is the definitive word on patient care. Taking proper care of a new hip joint isn't about guessing or just going with your gut. It relies strictly on these evidence-based protocols to make sure your body heals efficiently and safely.
Let's break down these foundational steps. First up is incision care. You got to keep that surgical area clean and dry. This means strictly following your surgeon's advice on when you can finally take a shower. Usually sponge baths are going to be your best friend for the first few days, which, yeah, is unglamorous, but it's absolutely crucial. You'll also want to monitor for any signs of infection, like excessive redness, heat, or unusual drainage. Next up is managing swelling. Swelling is completely normal, but you control it by elevating your leg and applying ice packs wrapped in a towel. And finally, pain management. Medline Plus emphasizes staying ahead of the pain. Don't wait until you're in absolute agony to take your prescribed medication. By maintaining a steady baseline of comfort, you're actually allowing your body to relax and focus all its energy on healing the tissues around your new joint.
Moving right along to Phase 2. Safely resuming daily activities. Moving outward.
This is the phase where your recovery moves outward. You're stepping out of the bed, moving around the house, and starting to interact with your physical environment again. To guide us through this, we turn to the American Academy of Orthopedic Surgeons, or AAOS. These are the actual folks who perform the surgeries, so their guidelines on activities after a hip replacement are the definitive source for safely managing your daily routine. They know exactly how much stress your new joint can handle at every single stage of the healing process.
Now, what's really interesting about this is how the AAOS draws a strict, practical line between what's safe and what you absolutely must avoid. On the safe side, walking with a walker or cane to distribute your weight, sitting in firm high-back chairs with armrests, and using elevated toilet seats. Why? Because these specific activities keep your hip angle open. But you've got to avoid those low, squishy sofas, and you absolutely must resist the very tempting urge to bend all the way over to tie your shoes or pick up a dropped remote. Seriously, just let it live on the floor for a bit. Bending your hip past 90 degrees is the ultimate enemy early in your recovery. It might feel a bit weird to use long-handled grabbers or a shoehorn at first, but following these strict boundaries is exactly what guarantees your tissues heal tightly and securely around the new hardware.
Which brings us to our final phase, preventing hip dislocation, protecting your progress.
You've put in all this hard work with wound care and modifying your daily activities, so let's establish the physical boundaries you need to protect that progress. Before we talk prevention, let's clearly define what we're actually trying to avoid here. In a total hip replacement, the surgeon replaces your natural ball and socket joint with a metallic or ceramic ball and a synthetic cup. A dislocation happens when that new ball pops right out of the socket.
During the surgery, the muscles and ligaments that normally hold that joint tightly together were stretched or cut. So in those first few months of recovery, those tissues are still weak and healing. Without their full strength, the only thing keeping that ball in the socket is your commitment to moving correctly.
So, how do we prevent it? Well, the AAOS provides a vital set of rules, often called hip precautions. First, never cross your legs or your ankles, whether you're sitting, standing, or lying down. When you sleep, you'll probably need to use a special abduction pillow between your legs just to keep them separated. Second, do not twist or pivot your operated leg inward. If you need to turn around, you actually pick up your feet and step, rather than twisting on your planted foot. And, as we mentioned earlier, absolutely no bending at the waist past 90 degrees. And this brilliantly illustrates how adhering to these precautions changes the game. Your safety isn't just in the hands of your surgeon anymore. It puts the power of a successful recovery entirely in your own hands.
Let's bring this all together. What we've covered today really boils down to 3 core pillars of official guidance. 1. Foundational care, managing the wound, the swelling, and the pain. 2. Activity management, modifying exactly how you sit, stand, and move through your home. And 3. Dislocation prevention, strictly following your hip precautions while the soft tissues heal. Mastering these 3 pillars isn't just about avoiding setbacks, it is the absolute key to unlocking the full potential of your new joint.
And that is the ultimate takeaway here. Master these pillars to unlock your pain-free mobility. The surgery gave you the new joint, sure, but your dedication to this roadmap is what actually gives you your life back. So I'll leave you with this. Knowing that your daily choices directly engineer your recovery, how are you going to consciously approach your very next step today? Thank you so much for joining me on this explainer. Stay safe, stay mindful of your movements, and here's to a fantastic recovery. Catch you next time.